I'm Heather Mongilio, a health reporter for the Frederick News Post. I'm joined by Frederick County Health Officer Dr. Barbara Brookmyer and Dr. Manuel Casiano, Chief Medical Officer of Frederick Health Hospital. I asked Dr. Brookmyer and Dr. Casiano to join me to talk about COVID-19 and answer any questions anyone might have about the new disease. In Maryland, we have 6 positive cases of COVID-19, although none of the positive cases are here in Frederick. Dr. Brookmyer and Dr. Casiano, can you just start by giving us an update on the situation?
So for the cases in Maryland, which is what we're most interested in our immediate vicinity, is that from the information that I have, all the cases acquired their infection or became infected as a matter of their travel outside of the state of Maryland. So they were all travel associated, that's how we term that, rather than having caught it from someone here in Maryland.
Anything you'd like to add?
Well, just that at the hospital we haven't had anyone sick enough from this virus to be admitted, so these people have been followed pretty much at home.
All right. So let's just start by saying, what are the symptoms of COVID-19 that people should be aware of?
So the symptoms are much like a cold or flu that people have. So they might have a fever, most people do, but not everybody does. They might have a cough, they might have a stuffy nose. There are a variety of other much less common symptoms, but that's part of the thing that makes it very difficult. Right now we're still in a situation where flu activity is widespread in our state and in the whole U.S. And so those flu symptoms also are very much like the symptoms from the novel coronavirus.
All right, and so how does the new coronavirus disease infect a person, or the new coronavirus itself?
So, I was going to say so. I don't want to hog the whole thing. So there are 2 main ways that we think about in terms of how do people become exposed to it. So when we talk about the risk, there's first the risk of exposure, and the ways that people can become exposed. One is through respiratory droplets. So we're sitting here less than 3 feet apart. I will try not to spit when I talk, but I might. And so if when I spit and I talk, if it lands on your mucous membranes like your mouth, your eyes, or maybe under your nose, but then you rub your nose later, you could actually be giving the virus entry into your body. But also by sneezing and coughing, that's why we recommend that people either cough or sneeze into their sleeve, and ideally away from someone else. Or if you have a tissue handy, but then with the tissue you also need to then dispose of it right away, and then you need to wash your hands. So that it seems like that's the main way that people are becoming infected, is because they are getting those respiratory droplets that go 3 feet, maybe up to 6 feet. But if you give yourself a 6-foot buffer from people when they're coughing, sneezing, talking, then you're relatively well protected. And then the other way that there has also been a lot of attention and focus on by folks and a lot of concern is potentially after somebody has coughed, sneezed, or spit talked, then surfaces around the person might become contaminated. And so I understand that a lot of people are concerned about contaminated surfaces. One of the things that I'd like to say about the potential for surfaces to be contaminated and then result in somebody getting ill is it seems like that's not a very common way for people to have become infected. And I would also say that is much easier to prevent than to prevent yourself from coming in contact with somebody's respiratory secretions. And the reason why I say that's relatively easy to prevent is because if there's a surface that's contaminated, so say a table or a door handle, if I don't touch those contaminated surfaces, then I don't have to worry about my hand becoming contaminated. And then, as another layer of protection, if my hand, whether contaminated or not, if I'm not putting my hand on my mouth, my nose, or my eyes, then I wouldn't be giving the virus an opportunity to even get into my body. So in terms of the contaminated surfaces, I like to think of it as 2 layers of protection. don't touch contaminated surfaces, or if you do, use a tissue or something. But then also, even if it's not realistic sometimes to avoid all those contaminated surfaces, if they are contaminated, so that's assuming it's contaminated, the other measure that you can do is to just take precautions, be self-aware of how often we touch our faces, and to stop doing that. And for people to be willing to have somebody else say, oh, if you just touched your face without having washed your hands, to make it something culturally acceptable to say to somebody, oh, did you know you just, I don't know, rubbed your nose, and then that can help that person to be more self-aware. I mean, they've already done it, but it can help them be more self-aware so that they are less likely to do it in the future.
And the third part of that gets right to what you were talking about, which is wash your hands, clean your hands frequently.
Right.
Because you're always going to end up touching something, even if it's your own face.
Yes.
And so you've got multiple layers of protection there. Try not to touch things that might be contaminated. Don't touch your face. Clean your hands often. And soap and water is every bit as good as all of the packaged antiseptics and creams and so on.
Good addition.
So how infectious is COVID-19? What is the current fatality rate?
Well, so we have information from about 70,000 cases so far. And so the majority of those cases, in fact, maybe for all 70,000 are the ones that have come out of China. And I do also have to say that the healthcare system in China and a lot of the other countries is different from the United States, where we have a very robust, strong intensive care unit system set up. So I first need to say that we're starting from a different position in terms of our healthcare system and the ability to take care of very sick people. So the fatality rate after looking at the 70,000 cases is about 2 to 3% of people who were confirmed cases. So that's not out of everybody, that's out of people who were confirmed as cases. That's the fatality rate, but it definitely differs by age. And I'd be happy to talk about that a little bit more, about age and also the fatality rate experience in some of the countries where they have done their own research.
There was a study that just came out, I believe, this morning out of Germany of about 1,100 people proven positive with only 2 fatalities in that whole group. So now you're starting to get down into fatality rates that are very similar to the flu. Mm-hmm. The problem with fatality rates up to now, they don't necessarily apply to our health care system, as you said. And the other thing is, since we don't screen for COVID-19 at this point, we're not testing the whole population. We don't really know what the denominator is. We don't know how many people actually have it and just never know they have it. Because we certainly know that there are people who can have it and never really have much in the way of symptoms or very mild symptoms. So we really don't know what the fatality rate is at this point, and until we do widespread testing, which we'll probably follow it later in the year, I don't think we're going to know. So my own feeling is that 2-3% that you see in some of the studies is probably at the high end, and it's probably a lot less than that.
Mm-hmm. So before we get into how age changes this, how about for every one person, how many people are generally infected with this disease?
So I think we're still seeing about 2 to 3.
Exactly.
All right. So you mentioned that the fatality rate and how the disease affects people changes when you get older, and I know that a lot of attention is on that 60 and older population. Can you expand on that?
Yes. So I'll start first with younger persons. So about just for the confirmed cases, so about 2% of the confirmed cases out of the 70,000 examined, about 2% were, now I forget, we say we're under 20. I think that's maybe how the grouping is. And then when we look at the fatality rate, the case fatality rate in South Korea, I think they reported that there were no fatalities under age 30. And then in Japan, no fatalities reported so far under age 50. So that makes the youthful age, everybody who's under 50 is glad to hear that, or those that are at 49 are probably glad to hear they're in with the younger age group. But so looking at the research though, the fatality rate is very low until you start getting to age 60, and then each decade above age 60, the death rate increases significantly. And especially for those who are age 80 and over. And that's even for people who don't have chronic health conditions, so it's age alone. When you look at folks then who have chronic health conditions like high blood pressure, diabetes, lung disease, then folks, regardless of their age, who have those conditions are also at risk. So if you look at someone who is 80 or older and they have high blood pressure or diabetes or lung disease, then they're at an even greater risk of having severe complications, including death.
The other side of that older being more dangerous to older folks is, again, exactly the same as with the flu. What's different is the younger part, because if I'm not mistaken, we've already seen 7 kids in Maryland die of the flu. And yet the COVID-19 really seems to spare kids. It's very unusual, even overseas, to see kids die from it. So it's just a different virus than influenza, worse in some ways, better, if you will, in some ways.
Well, I'm glad you brought up the flu. Because a lot of people seem to have gone from being only concerned about COVID-19 to now saying, oh, well, we should just be worried about the flu. Can you talk a little bit about how COVID-19 is different from the flu and that happy medium about being concerned for both diseases?
Well, in comparison with the flu, if I had little kids at home, I would probably be less worried about COVID-19 for them than the flu. Right now, if I were 80 years old, which is what I consider old, I think 60 is pretty young, to be honest with you, but it's all in perspective.
It is.
But at, if I were 80, 85, I would be more worried actually about the flu right now, even than the COVID-19, just because there's so much of it around. But they're both dangerous to 85-year-olds. That's just the nature of being 85 years old.
Right, because just like so if it were July and someone were coming in with respiratory illnesses, you're not necessarily thinking, oh, it's the flu. You're thinking about what is commonly circulating at that time.
Exactly.
And that's just it with this, is that depending upon what is circulating in our community, that's what someone is more likely to have as the cause of their illness. It isn't 100%, but it's just what's more likely. And right now, influenza is still more likely because in Maryland, we haven't had any cases of the novel coronavirus that have been cases that have become infected in Maryland person to person.
All right.
So if I were, again, 85, any year, not just this year, would probably be a good time to avoid large groups with lots of people sneezing and coughing. That was true a year ago during the flu season. It's true this year.
Yes, and unfortunately, even as we age, even if we do everything right, our immune systems do have a reduced effectiveness with time. So I know I've heard some people say, well, so-and-so exercises every day and eats right and gets all the right sleep. Does that person really have to worry? And unfortunately, our immune systems, despite our best efforts, don't work as well when we get older.
All right. For those just tuning in, I'm here with Dr. Brookmyer of the Frederick County Health Department and Dr. Casiano of Frederick Health Hospital. We've just been going over some of the basics around COVID-19, the new coronavirus disease. We're now going to take some audience questions that we've either gotten before this live cast or that we're getting now. So to start, if I have a child and they're constantly putting their hands in their mouth because they're just too young to know not to, should I not send them to school out of precaution, and will that be like be considered an excused absence?
How about if I respond to this one?
Go for it.
Yes, okay. So at this time in the Frederick community and in Maryland, we don't have any evidence that there's community spread, so person-to-person spread. So the background rate in our community is 0, and risk is related to exposure, and right now if there is no exposure, then there would be no risk. So it's considered, low risk for all persons in Maryland at this time. And I would also like to bring up that what we've been talking about is the precautions that you normally take during the seasonal influenza season are the same types of precautions and actions that one should do now in terms of trying to keep one healthy and to reduce the risk of exposure.
And having said all that, to your original question, does anybody have little kids who don't put their fingers in their mouth and all the time?
Yeah.
Because I've never seen them.
Right.
So what is the first thing someone should do, especially if they're in their 70s or 80s, if they start noticing symptoms of COVID-19?
Talk to their doctor. Give the doctor a call. That makes more sense than going to the doctor's office. Give them a call, talk to them, use, if they like, our online video method of talking to our doctors. Just call the office, either one, get advice from there.
Yes, and so again, so what your healthcare provider's office will take into consideration when they're talking to someone about their individual situation is what is circulating in the community. And right now it's influenza, and so it is helpful if somebody is having symptoms of, that are both the symptoms of influenza as well as the symptoms of the novel coronavirus. It's helpful for people to have a conversation with their healthcare provider, because if it's influenza and if they're at greater risk for complications from influenza, then the sooner they get tested for influenza and start treatment, because the treatment for influenza is most effective if it started within 72 hours of the beginning of symptoms. So for that reason, it is important to have a conversation with one's healthcare provider, whether or not there is concern about the novel coronavirus. And again, I would go back that in order to have the illness of the novel coronavirus, one needs to have had exposure to the novel coronavirus. And at this point, we don't have any evidence in Maryland that it's been circulating widely in the community.
All right.
If I could just add for a second there, again, the precautions that you would take are exactly the same as for the flu. And, so if you're feeling poorly a year ago, such that you would call your doctor, you would do exactly the same thing this year. The only difference this year is be ready to answer questions like, have you traveled out of the country? If you have, where have you traveled? Have you been in the Seattle area recently? Questions like that probably you wouldn't have been asked a year ago. So that would be about the only difference I would see at this point.
Okay, so we have a question from one of our older residents who said that their daughter and their daughter's high school age son wants to visit for spring break, but they want to know if they should cancel their trip.
So I would say for all these, it's individual decisions. If someone was coming from an area where there has been community spread, person to person, which I think last night, from what I heard from the federal briefing, they're considering just 4 places in the U.S. as having that community spread, then that's worth thinking about. But it might be that even individuals coming from those areas haven't likely had any contact or exposure with somebody who has been symptomatic and potentially have been exposed to the illness. So it really needs to be done on a person-by-person basis. Very, they're in somebody traveling from the U.S. If they're not coming from one of the places in the U.S. where there's been evidence of community person-to-person transmission, then I'd say it's still considered low risk.
I would agree with that. I think the other two other important factors. One are, do the folks who are coming to visit have symptoms?
Yeah.
I mean, if they've got a cold and a fever, then no, don't visit. If they're bringing their kids along who have been sick at school, no, don't visit. Again, not because of coronavirus per se, but it's very likely they might have had the flu. And if they're visiting their grandparents, that's the best way for grandparents to get the flu.
Mm-hmm.
The other side of it is, what is the health status of the folks that are being visited? So if they have a lot of chronic medical problems, or they're frail, or they're immunocompromised, or on special medicines, heart disease, lung disease, that kind of thing. Again, not just for coronavirus, but any time in this season, having folks who might get them sick might not be a great idea. So it's totally individual,
Right.
just like Dr. Brookmyer said, and it depends on a lot of factors.
Right. I know grandparents who that is how they approach their every opportunity with their grandkids. It's a questioning in advance who's been sick in the last day or so.
All right. Also from one of our older residents, for those who are in the more vulnerable, high-risk demographic, should they be concerned about products being shipped from China?
There isn't any
No.
evidence that that poses a risk.
All right.
And the other thing of that is even packaging materials, books. There's no evidence that coronavirus is transmitted on paper or that kind of thing.
So for those who are maybe getting cold symptoms but no elevation of their temperature, does that rule out COVID-19?
It does not. There have been some people who have had confirmation of the infection who did not initially present with a fever. Now, they may have had a fever at some point, but so the short answer is a fever isn't necessary in order for someone to potentially have it.
But when they call their doc to ask these questions, as they're going to do, another useful thing it would be to say, what has been my temperature? I've measured it, here's what it is. Because the doctor or healthcare provider is going to ask that.
Yes. And again, currently we have no evidence and no information to suggest that in Maryland or in Frederick County that there is community person-to-person spread.
For FCPS, the Frederick County Public Schools, should they be asking all their students to wash their hands and maybe mandating it before they go to lunch?
Yes, they should be doing that all year long, every year.
So there isn't anything different from, and it's a lot of the guidance I'm giving other people. So there are some measures that are good measures to do any time of the year. So even when it's not flu season, I describe it as norovirus season all the time. That's the virus that previously was known as the cruise ship virus, but it's the one that causes the gastrointestinal vomiting, diarrhea symptoms, and it's now the most common cause of foodborne illness. It's not salmonella anymore, and that's because of the frequency of hands being contaminated after using the bathroom, and then those contaminated hands touching food products. So anyway, I guess I don't need to go more into that. But I think it's a balance of also what's practical and reasonable.
How about the CDC guidelines for testing? Are they too limited at this point?
You want to take that?
So, well, I mean, it depends for what purpose,
Exactly.
right? So if we want to know, so people who are severely ill, do we want to have a better idea of what it is that they are ill with so that we can better target treatment? Then the answer is yes, we would want to be able to test the severely ill. And right now the criteria would capture those folks if they're hospitalized. So in the US, the hospitalization has been for people who needed that level of care. And so yes, you want to know what somebody has. They would have a variety of tests that are conducted to try to identify what they might have, again, so that the treatment can be specifically targeted and tailored to what they have. So that would be one purpose, managing people who are ill. Then there would be another purpose for testing, and that would be to have a better understanding of how might it be, how might the infection be spread, how might it be, might there be people out there that we haven't recognized because they haven't had symptoms. So then that would be another approach to testing, which is to test everyone who has been a contact of a confirmed case. Then we'd have more complete information about those transmission patterns. And then finally, a third approach to testing would just be test everybody. And the reality, though, is that it takes a while to get, for this situation, to get the testing system ready to have the capacity to handle that volume of tests. And right now, the public health laboratories, which the CDC guidance is much more closely aligned with, prioritizing the running or the processing of those samples by the public health laboratories to those people who are ill, because it will help make some treatment management decisions. Because the capacity and the volume or throughput of the public health laboratories is limited, the CDC wanted to help healthcare providers and help the laboratories to better prioritize which samples should be run. And then I guess now it's been a week ago, Vice President Pence, in one of his public briefings, had indicated that the private commercial labs would start making their own versions of test kits available, or that they would be processing samples as well, in addition to the public health laboratories. Then I think once the commercial labs have a greater capacity, and then once the rest of the healthcare system has a greater capacity to collect those specimens, then we might get closer to seeing what I described before, where anyone who wants to be tested can be tested, and that would give us, well, I would say it would give us lots of good information, but that kind of testing, though, as far as I know, isn't those results, and people's symptoms aren't going to be sent to a database, so we actually won't even benefit public health-wise or epidemiology-wise from that information. We won't have anything to glean from that, really, unfortunately, to better understand what is the experience out there in the asymptomatic or the people without symptoms population, or the people who just have such mild symptoms that they didn't go to their healthcare provider.
Yeah, I'd think of it that it would be really interesting from a research point of view to know the entire population, to test the entire population, but we're not there yet. We don't have the supplies, the test kits, and so on to do that. So really the focus has to be on folks that are sick enough to need care. So how do we know how to treat them? So at this point, the CDC's guidelines do make sense, because we don't have enough supplies to test the entire population, and there's really not much to be gained from that for any individual person. Maybe from a research point of view it would be interesting, but if you have the sniffles and a low-grade fever that's going to get better in a few days, what difference does it make, really?
Yeah, the treatment isn't going to be different. You might stop looking for other causes, but again, if somebody is so severely ill, all efforts are going to be made to try to find something that's effective. But knowing that, well, I guess for public health purposes at this point, when we're still trying to identify all the cases and then try to identify their contacts so that they can receive guidance about symptoms to look for themselves. But so right now, I guess that would be an additional benefit of people having had the test performed and knowing whether or not they tested positive or not, because then we would still be we're still in a situation right now where we would take additional public health efforts to try to contain the spread of the infection.
Right. Could there be a possibility that this virus might cause damage to unborn babies, especially brain damage?
I have not seen any research that actually answers that.
I have not as well, but the Centers for Disease Control will be having a conference call for clinicians Thursday, I believe, and it is focused on women who are pregnant and infants.
Right.
So we expect to have more information coming out there. I think it's just the numbers of individuals who have been impacted has been a much smaller number, but we are all eager to see that information.
Okay. If someone suspects that they have COVID-19, how do they approach being tested? If going into ER or urgent care, would that put others at risk?
Definitely. So that we get back to the same discussion earlier. The first thing, call your healthcare provider, talk with the symptoms, answer the questions. The health department has been superb at giving doctors, nurses guidance in terms of, okay, you've got this specific case, this person has this, they did or didn't travel, put that picture together and say whether they should be tested or not. So we've really relied on Dr. Brookmyer's team to give us guidance as to who needs testing. If you just go to the ER, unless you're sick, you're going to be turned away, and all you've done is expose the other folks sitting in the waiting room with you to whatever it is you have, which these days is most likely the flu.
All right. And Dr. Casiano, I think this is a question mostly for you. Does Frederick Health Hospital have in place plans for widespread cases of COVID-19? How would the hospital prevent being overwhelmed if we see the same number of cases that people are seeing in China or Italy or et cetera?
We do have emergency plans, surge plans for really any infectious kind of disease or any, two school buses crash. So we do have contingency plans for dealing with large numbers of patients, and a lot of it will get down to triage, who's sick, who's not as sick and can wait. We have a fair bit of experience in this area because for a number of years now we've been one of the assessment hospitals in Maryland for communicable diseases. I mean, that started back in the days of Ebola. So we have staffing plans, we have stockpiled materials, masks, all that kind of thing. Is it conceivable that there could be so many sick people that we'd have to set up tents on our parking lots? Yes, we've got tents. We'd rather not use them, but we've got them if we need them.
All right. And Dr. Brookmyer, you mentioned the 4 areas of community spread that Vice President Pence mentioned. Can you say what those 4 areas are for people who are concerned about traveling?
I had wanted to look that up. That was one of the things that I heard later last night. So Washington State would be one of those for sure, but I wouldn't want to misspeak about the other 3. I have their location in my mind, but I'm not confident on which those 3 were. And waiting to see the official documents coming out.
If folks want to do their own research, Johns Hopkins, if you Google Johns Hopkins coronavirus map, there's a wonderful interactive map there that'll show you graphically where are the areas that have had the most cases.
Yes, yeah, that is a good one to look at. It will look similar to some of the games, an online
Video
app.
game.
Yes,
Yeah.
it looks a lot like that. And then also at Johns Hopkins at the School of Public Health, they also have Dr. Sharfstein just started on call with the doctor, but his first interview was with a researcher who is researching the spread of the coronavirus. And I think people might find that interesting.
Mm-hmm.
All right. So someone wants to know what's up with the toilet paper shortage, and on a more serious note, what supplies should people be stocking up on in case that they do need to go for a 2-week quarantine period?
Well,
Whatever people use in 2 weeks' time. So I did have a conversation with somebody who said, naturally I have run low on toilet paper in my house, and when I went out to look for it, I had difficulty initially finding it, and it's not because that person was looking to hoard, but it was just in the natural turnover in their house, it was that time. So I think that's what people should think about, is taking a look at the things that you anticipate that you would normally use in a couple weeks' time, and to make sure that you have that. So it is also important to say that the governor did on Friday, made the announcement that he was directing all insurance companies who sell their product in Maryland that they must allow for people to refill their prescriptions early. So many people are familiar with they can't get the prescription refilled because it's not that time yet. Well, the governor's action was directing the insurance companies to allow people to get an extra 30-day supply earlier than their usual refill. So I'd encourage people to do that now. And then, let's see, I forget what else we were talking. Oh, what should people be doing? So, but then also thinking about the food in their house. Think about other people that they take care of. Also, if you're a family member and you take care of someone else, maybe in your house or outside of your house, but to think about if that person relies on you, well, what if you're ill and you don't want to make them ill? So it's the things that people do perhaps during cold and flu season anyway. And then also think about your neighbors. If your neighbors don't have somebody who is able to maybe get what they need, because certainly, like all of us, when we feel sick, not only do we not want to go out and potentially infect other people, but we also don't feel good, and who wants to go through the grocery store when you're not feeling well? So that's one of the reasons why you would also want to stock up now, sooner rather than later. It's good for all purposes, whether we have a hurricane, so after this we'll be going into hurricane season, so it's good to have those supplies on hand.
and I just want to reiterate, I think the most important thing is making sure you have a 2-week supply of medicines. If you take chronic medications. That's a little harder for anyone to help you with. Your neighbor can always go out and buy you some groceries and leave it on your front porch, and and they have zero risk of, even if you had the COVID, which is very rare, but even if you had that, your neighbor could drop off groceries, toilet paper, whatever it is, on your front stoop, and you go out and get it later with zero risk to them. It would be much harder for them to refill your medicines.
Mm-hmm. Good point.
All right. Excuse me. All right. So for those who are in the 60 and older population, if they had any scheduled large events where they might be attending and other 60 and plus older people might be attending, should they stop going? Should people who are throwing those events where they have a large 60 and older population attending, should they just cancel those events?
So the Centers for Disease Control and Prevention did modify their recommendations or be more specific about their recommendations, I think, as of last Friday, and that is for persons who are at greater risk, so the vulnerable population, so greater risk either because of their health conditions or because of their age. They were recommending that they avoid spaces where they would be very close to other people and with poor air exchange, and that's out of concern for the respiratory spread, which again, that is the same during the cold and flu season, and we still have influenza widely circulating, so it's a good idea anyway. But people should make their own individual decisions.
But if you think about it, large activities are also where you're generally going in and out of doors, so lots of doorknobs. You are in close proximity with people who are coughing, sneezing, whatever. So, yeah, I think people should be more cautious than perhaps they would have been. Given how many elderly die every year from flu, that's probably good advice every year, not just for COVID.
Right, right. If we've had over 20,000 people in the U.S. die from influenza already this flu season, you know, that's a pretty large number.
All right. Well, it looks like that's all of our questions. Is there anything else that the Frederick County residents should know or that you'd like to tell them about COVID-19?
Well, I'd just like to mention a couple of resources. People can dial 211 and get information now on COVID-19. They can come to the hospital website, frederickhealth.org. They can go to the CDC website, which is an excellent website, and actually the Maryland Department of Health website is also an excellent website, has links to a lot of the CDC information. I think the more you know about this disease, probably the more reassured you will be. I know this is Facebook, but Facebook is not where I would get my primary information.
This one session accepted.
Exactly. I hope so. But,
right.
but there are excellent sources of information out there, and I would encourage folks to use those and educate yourself.
All right, perfect. Well, thank you both so much for coming on. This will be on our Facebook page at facebook.com/Frederick News Post. You can also see it on our website, and even though this is a live Facebook, we will have a recorded part of the video that will be available for sharing or watching afterwards. And while we try to answer as many questions as possible today, if there are any other questions, feel free to email them to citydesk@newspost.com, or you can tweet them or ask them on Facebook, and we will try to get answers as we continue to cover this. Again, thank you so much.
Thank you for having us.
Yes, thank you.